Okay, my name is Dr. Aguta Olikachi. I'm a senior registrar in cardiology. Cardiology is the part of medicine that deals with the heart and the things concerning the heart. So, but it's a stage by stage thing. We first become a physician generally of all the areas before we now specialize and narrow down to one area. That's how we train as doctors. So that's my area, and I'm glad to be here. I'm glad to be a member of this church. I'm glad to be in this gathering, and I'm also glad to interact with you this evening. Hallelujah. Okay, today is caption health talk. It's caption health talk, but we cannot talk about everything in one day, everything pertaining to the human body. And it's only nice that we narrow down to the areas that concern us and the areas of our specialty. So, I will just do a little talk on cardiovascular health or cardiovascular diseases, just a little talk on it, then I'll open the floor so that we'll entertain questions concerning that. Why did I choose cardiovascular disease or cardiovascular health? In the whole wide world, cardiovascular diseases are the commonest cause of death. That is true. It's not communicable disease, it's not malaria, it's not infection, it's not typhoid. It's not any of these things. It's actually cardiovascular diseases. That's the commonest cause of death worldwide. So that's why we are narrowing down to it. And there is something also peculiar about cardiovascular diseases, why we need to talk about it. But we'll get to that. So we'll take it step by step. I intend to make the talk short so that we'll have more interactions. Alright, so when we say cardiovascular, it sounds big. Cardiovascular disease. So cardio represents heart. Those that did the Greek or all this mythology, you know that cardio usually refers to heart. Then vascular. If you did a little biology, you know that vascular has to do with blood vessels, the human blood vessels. And in its simplest form, we have arteries and we have veins. So the heart is the muscular structure in the center that pumps blood. So it pumps it out through the arteries to all other parts of the body, to nourish them with the blood and the contents of the blood. So when they are done using that blood, they now put the blood back to the veins. Veins are the other vessels that carry the blood from every other area where they are used back to the heart. So you see that there is a central pump, which is the heart. Then there is the first pipe, the arteries that carries away. There is the second pipe, the artery the vein that brings them back to the heart. The heart will now send to the lungs and put back all the nutrients. The lung will put all the oxygen, bring it back to the heart. The heart will now do that cycle again. So diseases that affect the heart, those blood vessels, arteries and veins, and the areas where they supply, they are the things that make up what we call cardiovascular diseases. So, and I already said that they're the commonest cause of death worldwide. So it's important that we look at them. Another thing that we need to, I believe I'm clear with what cardiovascular means. Yes, very, very clear. So in case you hear cardiovascular somewhere else, you know that that's what they're talking about. So there are the diseases that occur affecting this whole cardiovascular system constitute cardiovascular diseases. Common one is heart attack. You've heard of heart attack before? Yes. You've heard of stroke. before. Those are cardiovascular diseases. Some people can have what they call heart failure. Some people can have the ones that affect the arteries that go to the leg. So whether any clots, normally blood is supposed to be liquid, very liquid. You shouldn't have clots so that it can flow freely everywhere. So if something happens and clot forms inside, is a pipe. If you allow something to block a pipe, what happens? There will be no supply beyond that place where it is blocked. Am I right? Yes. So if you don't supply that area of blood, it doesn't get blood, it doesn't get nutrients, what will happen? That area will die. So that's how some of the cardiovascular diseases happen. Okay, so having laid that background for all to know, and I've mentioned some of the cardiovascular diseases we know, the place we will now come down to is what we call risk factors.